A question you might have is, how urgent is it for me to get these wisdom teeth removed? It's a pretty easy one in one respect, because if you're having swelling, pain, infection, and you're not feeling good and you think it's your wisdom teeth, that's going to move it up the urgency list. It's going to be a priority in your day to day because you're not feeling well and you're hurting. So obviously, then we can get you in and take a look at that pretty quick and talk to you about specifics. If you're not having any of those symptoms, but maybe you've had it in the past, it's went away, it's gotten better, but hey, I probably need to get this looked at, or maybe your dentist or your orthodontist told you from an x-ray you needed to get your wisdom teeth looked at to have them removed. That's a little different story. Uh, I tell people, when you schedule your wisdom teeth surgery around sports, vacations, significant activities, weddings, proms, school dances, all of those things come into play. Most of the time, it takes about a week to bounce back from a wisdom tooth surgery. But if you've got that significant event popping up on your calendar, you want to give yourself more time. I tell people I like to have a 2 week buffer. If you're going to go out of town on vacation, don't do your wisdom teeth and expect to be 100% that week. Give yourself an extra week recovery time before, or if you're not having problems, you can delay until after your vacation. Um, it's okay. And again, it varies from patient to patient, but the main thing is we want you to have the surgery, be fully recovered, enjoy whatever activity you're going to enjoy. Dead times for athletics. I know everyone. I have teenagers. I have young kids that are in sports, competitive swimmers and baseball player. There's year-round sports. They're practicing, they're playing, they're doing weekends all the time. You have to find a dead period. There's going to be dead periods throughout the year. You may have to leverage one of those to do your oral surgery, maybe right before, use the dead period to recover, and then be back in the game immediately after the dead period's over with. That's fine. People do use holidays, they do use fall breaks and spring breaks. It's just up to you. But all in all, 2 week buffer for significant events. Otherwise, a 1 week buffer is usually pretty good. Timing wise with school, if you're doing it in school, a lot of people will take uh, a weekend to recover. They'll do their surgery on a Thursday or a Friday, have Saturday and Sunday off, and then back to school on Monday or Tuesday. A lot of people use these school holidays. One of the famous ones is Martin Luther King Day in January. Patients will have their surgery on Friday, have Saturday, Sunday, and the additional Monday off, and back to school on Tuesday. That works as well. Or if you have a Friday that we're in the office and you have a Friday off, we can throw that in. So anytime you can give yourself an extra day or two, just in regular recovery, that's fine. But if you're doing significant events, give yourself 2 weeks buffer. And that's my take. It's my opinion. I've seen it over the last 20 plus years. That seems to work pretty well from a scheduling standpoint. If you have specific questions about your surgery, or whether or not you need your wisdom teeth out, you can give us a call. You can schedule a consult with me. You can go online, hit the orange button, request my consult. That'll go into the system. One of my team will call you and get that set up for a mutually agreeable time on our schedules. And we'll get you in here. We'll take a look and we can answer any more questions you might have about timing and about when you want to do this versus what you want to avoid as far as doing this too close to a significant event.